Hello, everyone. Professor Vig here. Welcome to the lesson on the anatomy and physiology of the endocrine system. We're going to talk about hormones, how hormones actually regulate every function in the body, from growth and metabolism to reproduction and stress responses. This system is often called the body's chemical communication network. Unlike the nervous system, which sends rapid electrical signals to communicate, the endocrine system uses hormones, which travel through the bloodstream to communicate with target cells throughout the body. Now, as we move through this lecture, we're gonna discuss major endocrine glands, their hormones that they produce, how these hormones travel and exert their effects, and how the feedback mechanisms help maintain homeostasis in the body. Understanding the normal functions of the endocrine system will help us better understand the disorders that we're going to discuss in our next lecture. Here are the learning objectives for this lesson. So the endocrine system consists of a collection of glands. They're distributed throughout the body. They secrete hormones directly into the bloodstream for communication. They act as chemical messengers, and they help coordinate activities between organs and tissues. Now, the endocrine system also plays a major role in maintaining homeostasis, and it does this by regulating metabolism, growth and development, reproduction, fluid and electrolyte balance, blood glucose levels, and even our responses to stress. Now, unlike the exocrine glands, endocrine glands do not use ducts, for the communication. Instead, hormones are released directly into the bloodstream, allowing them to travel to the distant target organs. Now, although the endocrine glands are scattered throughout the body, they do function together as a very well integrated system to maintain balance and adapt to changes in the internal and external environment. The functions of the endocrine glands. Hormones influence virtually every major body system. So one important function is regulating growth and development. Growth hormone, thyroid hormone, sex hormones, all of these contribute to normal growth and maturation. The endocrine gland system also controls metabolism, determining how quickly cells use energy and nutrients. The hormones regulate reproduction, including fertility, pregnancy, and sexual development. They maintain fluid and electrolyte balance by controlling water and mineral levels in the body. Hormones also coordinate the body's stress response, helping us adapt to illness, injury, and emotional stress. Additionally, hormones also regulate blood glucose levels, ensuring that the cells receive a steady supply of energy, right? So finally, they also maintain calcium homeostasis, which is essential for bone health, muscle contraction, and nerve function. As we mentioned earlier, these hormones act as chemical messengers, right? They travel through the blood to the target cells, and they do this to regulate function and maintain homeostasis. Now, to understand how they function, we classify them based on their chemical structure into three primary groups. First, we have peptides and proteins, which are compounds made of amino acids linked by peptide bonds. Familiar examples in this category include insulin, because remember we said insulin is a protein, right? And so this regulates blood sugar and growth hormone. The second group consists of steroids, all of which are derived from cholesterol as a, precursor. This group includes hormones like cortisol and the from the adrenal cortex, and sex hormones like estrogen. Finally, there are amines, which are derived from amino acid tyrosine. This group includes epinephrine, which manages stress responses, and thyroid hormones like thyroxine. To understand the endocrine gland disorders, it's really important to first distinguish between endocrine and exocrine glands. So I wanted to kind of touch on this a little bit. Now, although both types of glands produce and release substances, they differ significantly in how and where those substances are delivered. Endocrine glands are known as ductless glands because they release their secretions, called hormones, directly into the bloodstream, as you mentioned. Now, once in the circulation, they travel throughout the body and they reach the target organs and tissues. Now, because hormones often collect, often affect multiple body systems, endocrine responses tend to develop more slowly, but produce longer lasting effects. Now, examples of endocrine glands include the thyroid gland, pituitary gland, adrenal gland, the endocrine portion of the pancreas known as the pancreatic islets. Now, in contrast, exocrine glands, they release their secretions through ducts that carry the substances to the specific body surfaces or cavities. Exocrine excretions typically act locally rather than traveling through the bloodstream everywhere. Now, these secretions include enzymes, mucus, sweat, oil, saliva, and bile. Because exocrine secretions are delivered directly to their target site, their effects are usually more immediate and localized. Now, examples of exocrine glands include the salivary glands, sweat glands, sebaceous glands, and the exocrine portion of the pancreas that produces digestive enzymes. Now, one way to remember this difference is that endocrine glands secrete hormones into the blood, and exocrine glands secrete substances through ducts. An important exception is the pancreas, which is considered a mixed gland, right? Because it has both endocrine and exocrine functions. The endocrine portion releases insulin and glucagon into the bloodstream to regulate blood glucose levels, while the exocrine portion secretes digestive enzymes into the small intestine through ducts. Now, the key point to remember here is that endocrine glands are ductless and regulate body functions through hormones carried in the bloodstream, whereas exocrine glands use ducts to deliver secretions directly to specific locations for localized action. Here is a cheat sheet I created so you can use to kind of help you study this topic. Now, before we discuss endocrine disorders, it's really important to understand the major glands of the endocrine system and the hormones that they produce. That way you can recognize disorders and how they're happening, right? So at the top of the endocrine hierarchy is the hypothalamus, located in the brain. Now, the hypothalamus serves as a connection between the nervous system and the endocrine system. It monitors conditions within the body and produces and produces releasing and inhibiting hormones that regulate activity of the pituitary gland. Now, just below the hypothalamus is the pituitary gland, often referred to as the master gland because it controls many other endocrine glands, right? It's the big boss. So the anterior pituitary secretes several important hormones, including growth hormone, thyroid stimulating hormone, adrenocorticotropic hormone, follicle stimulating hormone, luteinizing hormone, and prolactin. The posterior pituitary stores and releases antidiuretic hormone, or ADH, which regulates water balance, and oxytocin, which plays a very important role in labor, delivery, and social bonding. Now, moving to the neck, we find the thyroid gland. This produces thyroxine, or T4, or triiodothyronine, or T3, and calcitonin. Now, T3 and T4 regulate metabolism, growth, and energy production, while calcitonin, if you want to guess, helps lower blood calcium levels. Okay. Located on the posterior surface of the thyroid are the four small parathyroid glands. These glands produce the parathyroid hormone, or PTH, which increases blood calcium levels and plays a critical role in maintaining calcium and phosphorus balance. The pancreas contains clusters of endocrine cells known as the islets of Langerhans. These cells produce insulin, glucagon, and somatostatin. Sorry, I could never pronounce that. Together, these hormones regulate blood glucose levels and energy homeostasis. Now coming to the adrenal glands. These are located on top of the kidneys. They consist of two regions, distinct regions. The outer adrenal cortex produces cortisol, aldosterone, and androgens. These hormones regulate metabolism, stress responses, blood pressure, and electrolyte balance. The inner adrenal medulla produces epinephrine and norepinephrine, commonly known as the fight or flight hormones, which prepare the body to respond to stress. Finally, we have the gonads, which include the ovaries in females and the testes in the males. These produce sex hormones responsible for reproduction and secondary sexual characteristics. Now, the ovaries produce estrogen and progesterone, while the testes produce testosterone. Now, together, these glands and the hormones, they work through a very complex feedback mechanism to maintain homeostasis and coordinate nearly every major physiological process in the body. And it's extremely important to understand which gland produces which hormone and what does it do, because when we start talking about the endocrine disorders in the next lecture, this is going to be very helpful for you to remember. I created this cheat sheet here again. I put the gland, the location, the major hormones, and the primary functions. You can use this to help you, remember these glands and hormones. Now, this diagram illustrates the journey, basically, of the hormone from its release from the gland, right, to its eventual elimination from the body, as well as how hormone levels are regulated through feedback mechanisms, right? So the process begins when an endocrine gland releases a hormone into the bloodstream. That's the beginning. Unlike exocrine glands, endocrine glands, we said, were ductless, right? So the hormones are secreted directly into the blood, and then they circulate throughout the body. Now, as the hormone circulates, right, in the blood, it travels to the specific target organ or tissue that it's meant to go to. Although hormones may be carried throughout the entire body, only the cells with the appropriate receptors can respond to that particular hormone. And this is that function those receptors play, right? The communication happens not just from the gland releasing the hormone traveling through the blood, getting to the target organ, and then connecting with the receptor on that, on that target organ or tissue. Now, once the hormone reaches its target tissue, it binds to that specific receptor, which is located on or within that target cell. Now, this hormone receptor interaction acts like a lock and key mechanism. This ensures that only the correct cells respond. So if you have like tons of hormones, which they are traveling through the blood, they're not just going to communicate with every organ. Obviously, there has to be some way for them to connect to the organ that they are meant for. And so that's where that receptor connection causes that physiological response. So depending on the hormone involved, this response can include changes in metabolism, growth, fluid balance, reproduction, blood glucose regulation, or other cellular activities. Now, once the hormone completes its function, it is metabolized or inactivated by that target tissue or the liver. Right? This step prevents hormones from remaining active longer than necessary. So for example, if ADH, the antidiuretic hormone, was released because somebody was dehydrated, for example, right? And so it gets to the kidney and it says to the kidney, it connects to the receptor and says, hey, let's retain the fluid. Okay, stop peeing, stop making your urine and excreting, so let's hold it in because we are dehydrated and we need to hold that fluid in. So now once it reaches and passes on that message, now after it's done, it's deactivated and, metabolized, from the target organ or the liver. Now the hormone byproducts are then excreted. The byproducts that are, from the metabolism then are excreted by the kidneys and eliminated in the urine. Now, this helps maintain the appropriate hormone levels in the body, right? So we don't have extra hormones circulating throughout the blood, connecting to every organ that it sees, miscommunication there, bad match, So they go to the target cell that they're supposed to go to, connect with the, receptor, create the physiological response that they're meant to create, and then they're metabolized. Now, most hormones are controlled by negative feedback mechanisms. This is our the final step that we're going to talk about is the feedback regulation. Most hormones are controlled by negative feedback mechanisms. When the hormone levels become too high, right, in the body, or the desired response has been achieved, the signals are sent to reduce further hormone secretion. Conversely, when hormone levels are too low, hormone production may increase. This feedback mechanism helps maintain that homeostasis. in the body that we want and ensures that the hormone levels remain within a normal range. Now, one thing to remember is that hormones are released into the bloodstream, travel to the target cell, produce a specific response, are broken down and excreted, and are continuously regulated through this feedback mechanism to maintain homeostasis. Now, one of the most important concepts, I want to talk a little bit more about these feedback mechanisms. You have negative and positive feedback mechanisms. Now, one of the most important concepts in endocrinology is how hormone secretion is regulated through feedback mechanisms. Now, these mechanisms help maintain homeostasis, we said, or a stable internal environment. Now, the majority of the endocrine hormones are controlled by negative feedback, as I mentioned in the previous slide. Now, in a negative feedback system, the body detects a change in a physiological variable and it initiates a response. It sees the change and it initiates a response. That reverses that change and it returns the variable to its normal range. So a common example, let me give you an example for this, is blood glucose regulation. Now, after a meal, the blood glucose levels are going to rise, right? Say, I decided to go to IHOP and I ate a big plate full of pancakes with syrup. What's going to happen to my blood glucose levels? They're going to spike, right? Now, specialized beta cells from the pancreas detect this increase in blood glucose levels. And what do? They release insulin into the bloodstream, right? So now that's your gland, the pancreas. It does its endocrine function. It releases the insulin into the bloodstream. Now it's going to go to its target cell, right? So now the insulin allows the glucose. It goes to the glucose, connects to the glucose, and it enters the cells where it can be used for energy or stored for later use in the liver. Now, as the blood glucose levels begin to fall back to normal, insulin secretion will stop or it will decrease. Now, this process, what does it do? It basically prevents excessive fluctuations in blood glucose level. So by what? By making sure that the insulin isn't just traveling in the bloodstream constantly and lowering the blood glucose lower and lower and lower, right? And this helps to maintain homeostasis. Now, on the other hand, the positive feedback mechanism, in contrast, it basically amplifies or reinforces the original stimulus rather than reversing it. Because remember, after the insulin goes and decreases the blood glucose, it stops, right? And then it's excreted. And the positive feedback mechanism, this mechanism amplifies or reinforces the original stimulus rather than reversing it. So positive feedback is much less common in the body and typically used when a rapid self-enhancing response is needed in an acute situation, right? Or in a situation where, okay, we need to increase those hormone levels because we need to do something fast. So a classical example of a positive feedback mechanism is the release of oxytocin during childbirth. Now, as the baby's head stretches the cervix, the stretch receptors send signals to the hypothalamus. In response, the posterior pituitary gland releases oxytocin. Because remember, we said that's the gland that releases oxytocin. This oxytocin stimulates stronger uterine contractions. So it's amplifying the effect, which further increases the cervical stretching. Now, this additional stretching triggers the release of even more oxytocin, right? So now it's amplifying it, right? It's increasing it because it has to continue and continue and continue. So creating a cycle of increasingly powerful contractions. Because remember, the cervix has to dilate 10 centimeters for that baby to come out. And so it's going to keep releasing that oxytocin till that happens. Now the positive feedback loop continues until the baby is delivered, at which point the stimulus is removed and the hormone release is decreased. So basically, in summary, negative feedback maintains stability by reversing a change, while positive feedback promotes change by amplifying a response until a specific outcome is achieved. So when does this go wrong? What happens, right? When will it go wrong? Endocrine disorders occur when hormone regulation becomes disrupted. So one cause is hormone excess, often resulting from hormone secreting tumors called adenomas, or from ectopic hormone production by cancer. Another cause is hormone deficiency. So either you have excess or you have deficiency, right? Now the deficiency could result from autoimmune destruction, right? Your body is destroying its own hormones, right? Infections, surgery, vascular damage, or genetic conditions. Because what happens when you have vascular damage, the communication is not, remember, it circulates in the blood, right? So those hormones are not going to be able to communicate with the target organs because we have vascular damage, which was caused by what? Like increased hypertension, uncontrolled blood sugar levels, all these atherosclerotic plaques from all the delicious fatty food we like to eat, like cakes and french fries and all that fried chicken and all that good stuff, right? So these cause vascular damage because they cause atherosclerotic plaques in our vessels. And so when these kind of things happen, the hormones that are circulating in the blood trying to get to the target hormone, target gland or tissue to create a response can't do it properly. The communication is disturbed, right? And even in genetic conditions, this can happen. So a third cause is target cell resistance. Does this sound familiar? Yes, type 2 diabetes, where hormone levels are normal, right? So the pancreas are going to release that glucagon, right? But what's going to happen is that the cells are going to fail to respond appropriately because they are resistant. So type 2 diabetes, very common example of this, right? Insulin is present, but the target cells become resistant to its effects. Now, regardless of the cause, endocrine disorders disrupt homeostasis and can affect multiple organ systems. Remember, our goal is our body needs to maintain homeostasis. So let's talk about the labs and diagnostics and imaging. How do we know when something goes wrong, right? This is how we validate information, right? All the data that we collect. So the first thing is our blood analysis, blood levels, right? Blood tests are the primary method we use to evaluate endocrine function and are often the first step in diagnosing endocrine disorders. Now, these tests help us determine whether hormone production is normal, excessive, or deficient. One approach is, for example, just like our HbA1c, right? I mean, when we check the blood or we check our blood glucose level or random blood sugar level, right? Right away, the blood will tell us, hey, too much blood glucose in the blood. Okay, now one approach is the measurement of serum hormone levels. Advanced lab techniques allow clinicians to accurately measure the concentration of specific hormones in the bloodstream. For example, elevated levels of thyroid hormones, specifically T3 and T4, may indicate hyperthyroidism. Similarly, abnormalities in growth hormone and thyroid hormones or adrenal hormones can help identify disorders involving the pituitary gland. See, this is why I mentioned it's really important for us to remember which gland produces which hormone. So if we see that, hey, the growth hormone is deficient or it's abnormal or T3 and T4 are abnormal, so then we kind of know, okay, which gland is going bad, right? Which gland is not doing its job. Now, another important diagnostic strategy is the evaluation of tropic hormones, such as thyroid stimulating hormone, or TSH, and adrenocorticotropic hormone, or ACTH. Because what do these hormones do? These hormones regulate endocrine glands. Comparing tropic hormone levels with target gland hormone levels will help us to identify the source of the imbalance. For example, if the target gland is producing excessive amounts of hormone, right, while the corresponding tropic hormone level is low, the problem is likely originating within the gland itself or from an ectopic hormone producing tumor. So that's the reason why it's so important for us to understand. Okay, for example, like if the thyroid stimulating hormone is high, then we're going to say, okay, why is the thyroid stimulating hormone too high? I mean, what if the thyroid T3 and T4 are also high, right? This kind of helps us to critically think and say, okay, what could be going on? Maybe they have hypothyroidism, right? And things, that's our critical thinking that we have to use to understand these things. Now we also assess indirect indicators of hormone activity. In some cases, the effects of a hormone on the body provide more useful information than the hormone level itself. For example, blood glucose levels are commonly used to evaluate insulin function. Okay, while serum calcium and phosphate levels help assess parathyroid hormone activity and calcium regulation. Now, finally, metabolic and electrolyte panels. These also help, especially they're very important during acute endocrine emergencies. For example, such as diabetic ketoacidosis or DKA. We measure serum electrolytes, including sodium, potassium, chloride, as well as ABGs, as we mentioned in our ABG lecture, right? These tests will help us identify metabolic acidosis, electrolyte imbalances, and the severity of the patient's condition. Now, together, the blood analysis provides, valuable information about the hormone production, hormone effectiveness, and the body's overall metabolic status, making them an essential tool in diagnosing and managing endocrine disorder. Now, while the blood tests are the primary method for evaluating endocrine function, other diagnostic tools are also often used to provide a more complete picture of hormone production, gland function, and structural abnormalities. One commonly used method is a urine analysis. A 24-hour urine collection is often preferred over a single blood sample because it reflects hormone production over the entire day. So we basically collect a patient's urine throughout the day. It stays in this container in their room in ice, and we just collect every time they need to urinate. We collect it inside that container. And then this provides a more accurate assessment of endocrine activity and hormone metabolism. For example, elevated urinary free cortisol levels are a key diagnostic finding in Cushing's syndrome, which is characterized by excessive cortisol production. And we're going to cover this in our endocrine disorders lecture. Urine testing is also important for patients with diabetes, right? The presence of ketones in the urine, known as ketonuria, indicates that the body is breaking down fat for energy due to insufficient glucose utilization. Now, ketonuria, it serves as an early warning sign of DKA, right? A potentially life-threatening complication of diabetes, which we're going to, talk more about in our endocrine disorders as well. Now, in addition to lab testing, imaging and radiographic studies help identify structural abnormalities that could cause hormone imbalances. For example, a magnetic resonance imaging or MRI, or computed tomography, a CT scan. These are frequently used to visualize the pituitary gland and the adrenal glands and to identify any tumors, adenomas, or other lesions. The ultrasound is commonly used to evaluate the thyroid gland for nodules and, nodules or enlargements or other abnormalities. Several specialized diagnostic test tools are also used in endocrine assessment. One important test is, like I mentioned, the HbA1c, the glycosylated hemoglobin levels, right, which measures the average blood glucose level over the previous 8 to 12 weeks. In patients with diabetes, an HbA1c of approximately 7% or lower generally indicates good, glycemic control. Another specialized test is the late night salivary cortisol measurement, which is used to diagnose hypercortisolism or Cushing's syndrome, high levels of cortisol. Because cortisol levels normally decrease at night, elevated nighttime cortisol levels can indicate abnormal hormone secretion. So why do the cortisol levels, you have to use your critical thinking, right? So why do these levels decrease at night? Because we're not awake and doing things. Except for people who work at night, night shifters. But normally at night, the body is resting, right? We're sleeping. And during our sleep, we don't need high stress levels. We're not under stress. Okay, I got to get this assignment turned in. I got to study for an exam, or I got to get this job done or that done. So you don't have that at night. And so your cortisol levels should be lower at night. So when gland lesions or nodules are discovered, what do we do next? As we mentioned in our cancer lecture, a biopsy, right, is the standard. It might be performed to determine whether the tissue is benign or malignant. This procedure is essentially, what helping us rule out cancer and to guide treatment decisions. Now, finally, the physical exam that we do, the actual assessment, can provide valuable diagnostic clues. All right. Physical assessment, big one. For example, the Chvostek sign, which is a facial muscle twitching triggered by tapping the facial nerve, or the Trousseau sign, which is a carpal spasm induced by, inflating a blood pressure cuff on the upper arm. Both findings indicate what? Hypocalcemia. And they can suggest underlying parathyroid dysfunction, right? Because that's the gland that is responsible for calcium levels. Now together, urine studies, imaging tests, specialized lab assessments, biopsies, physical exams, findings, these all help us diagnose endocrine disorders and identify the source of these imbalances. So before we finish here, just a little endocrine humor. As you see in this cartoon, the doctor says, we're very worried about your hormone levels. I mean, obviously, person looks, over, hairy, right? So while the cartoon is funny, it does highlight an important point. Hormones influence many aspects of our body, including appearance, mood, energy levels, metabolism, and overall health, right? So when hormone levels become imbalanced, the effects are seen throughout the body. And this is why it's very important to understand endocrine physiology, and it's so important in healthcare. And by the end, after listening to the endocrine disorder lecture, I'm sure you will understand a lot more why these hormone levels matter so much. And that is it for our endocrine A&P lecture.